Good evening. Welcome to Live United. Live United, where we have an opportunity to share all the wonderful work that goes on in the Monadnock region that makes a difference in the lives of our citizens. Today, I have the good fortune to have joining me Kate McNally and Tammy Dwyer. They join us from the tobacco prevention and treatment efforts here in the Monadnock region. Kate, you've been program director for a long time of that particular program, and Tammy's joining you and really focusing in on some policy work, which is very exciting to hear. So we're going to have a chance to really talk about this in a little more depth and share some of the new campaign work that you have going on to really impact policy. But Kate, if you could start out by just telling us, give us a little bit of history and background of how this started.
Sure. Thanks for having us, Kelly. We really appreciate it. I've been with the Coalition for Tobacco-Free Communities at Cheshire Medical Center for just about 12 years. And it actually started out in about 1997 when the region identified tobacco use by youth as a priority, that they really wanted to get the numbers down because they were really concerned about the number of youth that were using tobacco. So they formed the Cheshire Coalition for Tobacco-Free Youth. And they received money from the Master Settlement Agreement and other funding sources through the state of New Hampshire to work on initiatives related to prevention. Soon after that, I'd say in 2003, most of that money went away. The legislature found other uses for the tobacco settlement money, which we still do get about $47 million a year. But that money is now gone to other purposes. And so we, at that time, really kind of readjusted our focus to work not just on prevention, but on treatment as well, because we really needed to, and policy work, because we really needed to figure out what to do with limited dollars. And so we focused on, one, to prevent youth from using tobacco, to eliminate exposure to secondhand smoke, which is more in the policy area, and also to make sure that we're helping anybody that wants to quit using tobacco. So we've had a long history of doing that. We've done a lot of work in making sure that we're referring people for treatment to our treatment program, and also out in the community doing what we can to educate people about secondhand smoke and about prevention for youth.
Before we jump over to you, Tammy, Kate, I have one other question. You know, you talked about youth, and we're very aware that that's been a huge issue and concern. The amount that they're using, their introduction to it, and what that leads to further in their lives, that it's oftentimes an introductory, and it is a substance.
Absolutely.
Lots of times people don't think of it that way, but it is a substance that can be abused, and it's very addicting.
Yeah.
And you know, so when you start at a young age, you have the potential to pick up other very addictive behaviors, and that includes other substances or other kinds of behaviors. So the policy work becomes incredibly critical to all of this. But you mentioned that our young people have been a challenge around this. Is that true today, that they continue to be at risk for this?
Absolutely. Nicotine is the most addictive drug there is. It's more addictive than any other substance. And tobacco kills more people than any other preventable causes of death. And so we can't minimize that. It's really important. People are still dying at a rate of about 1 person every 8 seconds in this country. And youth, children, anyone really under 25, their brains are more susceptible to addictive drugs like nicotine. And nicotine is actually the only substance that has its own receptor in the brain. So it's the one that more people are going to get addicted to more quickly and stay addicted to longer. And you're absolutely right, it's a gateway drug. So if somebody's experimenting with tobacco, or they're experimenting with the electronic cigarette, which has nicotine in it, then they are really opening up that door to more risky behaviors. Unfortunately, that's the way it is. And I've done a lot of treatment with other addicts and alcoholics, and have found that they may be able to give up those drugs of choice, but still have a very hard time giving up the tobacco. So it's just one of those substances that's very addictive, and if you start out at a young age, which the average age of use is about 13, if you start out at a young age, you're more likely to be addicted for the long term.
I am going to come back to you, Kate, after we give Tammy a chance to talk here, to hear more about some of the cessation programs that you're doing, some of the tobacco intervention and prevention work. So I want to make sure we highlight that so the public's aware of how to receive assistance if they're in need of that. But one of the interesting pieces that you're doing is policy work, which is critical when you think about that they've cut they've taken this settlement dollars. They're not directing it where it's supposed to go. And that's a whole nother conversation in terms of politics, and boy, I love those. But Tammy, I'd love to hear from you how you were introduced into this work and what your role is.
Sure, thank you. And again, thanks for having us here. I have been working with Kate for about 8 months, and I was hired very specifically to focus on increasing smoke-free environments in the home, specifically multi-unit rental properties. And that is to protect everybody from secondhand smoke. Recently, I'm trying to think, I think it was around 2010 maybe, that HUD did a recommendation that public housing, affordable housing, implement smoke-free policies because they recognized that it was something imperative that we do to protect folks that are living in their home environment where they may choose to not smoke, but their neighbor is smoking, and the secondhand smoke is going to go through walls, electrical outlets. It's going to reach them. So I've been working with landlords, I've been working with residents, and we even started a smoke-free housing directory. So if you're a landlord, you can promote your rental property on this directory. And that's the work I've been doing.
So one of the interesting pieces of this, I think, is that in a way it almost becomes proactive and preventative when you really think about it, because especially with the younger population, where we're now getting into these housing units, potentially, Keene's a college town.
Yeah.
And if you can work with landlords and have impact there, we're having an impact on one of the populations that it's extreme high risk because of brain development and these other health issues that could become lifelong and long term. So really, really important work that you're doing. So tell us a little bit about what it's like to work with these landlords, with the HUD initiative, and how that's going here in the Monadnock region.
Well, there was some work done by Kate prior to my coming on board, and I am extremely pleased to say that Southwestern Community Service, Keene Housing, and Cheshire Housing Trust all have implemented smoke-free policies in all of their buildings. And so it's really incredible. And we consider that affordable housing. The other group that we're working on is what you would call market rate. So that's your regular people paying market rate rent, and that has been more challenging. It's right now it is considered a landlord market. So there's not a lot of competition for tenants. They don't have a high vacancy rate. And I talk to landlords, they're concerned about it, they think it's important, but what I'm finding is it's not a priority. And and that kind of leads to, I don't want to push us in that direction, but it leads to our t-shirts and our campaign. I mean, it's a big part of why we were doing this.
So let's talk about the campaign for a minute here, and I think we actually have a video that they can queue up for us that'll give us sort of a lead-in to discussing this, but you are wearing shirts. Hopefully in the video we'll get a better clue, because I'm sure, Kate, a lot of people are looking at yours and saying, what on earth does that mean exactly? Right. So Dave, if we're ready, we'll go ahead and run that video. And we can, if you can share with people anything you need to. Here's the hashtag. So how cool is that? You know, it's great. And I'm sure for young people in particular, you know, using the hashtags and
Sure.
using the WTF, boy, that was a good thinking on the part of the program. So tobacco-free. And why is that so important to get out as a message in a campaign right now?
Well, you know, we have to bring it back to make it a priority again. I think a lot of people assume that we've taken care of it, but we haven't taken care of it. You know, they really think that we've completed the whole tobacco thing, and people are still smoking. Youth are still smoking at an alarming rate. We've plateaued. We're not really making the dent that we would hope. So we really need to make sure that we're doing more to protect children, to prevent children from starting, and also to help anybody that wants to quit to do so. It is very important, and so I think it's just taken a back burner. I mean, because there are other priorities. We have a lot going on. But this is, like I said before, this is the single most preventable cause of death in our country today. Tobacco use kills more people than any other substances combined. So that's why it's really important. The Finish It campaign is a national campaign. You see hashtag Finish It. You know, we have to finish it. You know, we've got to finish it. And what finishing it means is when people are no longer dying or suffering from tobacco-related illnesses, then we know that our work is done. When kids are not starting to use tobacco anymore, we know that our work has been done. When we don't have kids turning to electronic cigarettes that have nicotine in them, we know that we've done a great job. So there's still plenty of work to do, and we really need to get our allies back at the table so that we can continue to set policies that are really going to make a difference. Increasing taxes on tobacco is one way that some states have had great success. You notice if you travel around New England, New Hampshire has the lowest price on tobacco in the New England states, and so people are coming to us to get their tobacco. We also have a very high rate of tobacco use, and you go around to other states that have higher taxes, and you can see a big difference in the rate of smoking in those other states. We know we can really make a difference. And I have a personal story I want to share with you, if you don't mind. I received this letter. This was back in 2010, and this was soon after the Keene Housing Authority set a policy to remove smoking from residences. And I received a letter from a woman, and a little bit of backstory is that we went to a forum. When we worked with the Keene Housing Authority to create the policy, we also offered residents help with quitting. And these policies don't tell people they can't smoke. They're just really helping people to get outside and not smoke where other residents share space. Because we know that secondhand smoke irritates people with asthma, it irritates the lungs of people with COPD and other chronic illnesses. And so we want to stop that and get the secondhand smoke away from people that are going to be harmed by it. And there was one woman at this forum at Keene Housing Authority at Central Square Terrace who was really upset. She was really afraid because she'd been smoking all of her life. And she sat in the corner and she actually cried. And she was afraid that she was going to be evicted from her home because she couldn't stop smoking. And we just reassured her, and we told her that there was a way that we could help her so that she just wasn't going to be able to smoke in her home, but we could help her so that it would be easier to do. And it's you know, a lot of people have a lot of fear around it. And the fear, in my opinion, is bigger than the actual event. You know, fear is really huge for a lot of folks. And she said, I've smoked 51 years. I received this letter from her on March 31st of 2010. I didn't know how to live with my smokes. I tried quite a few times to quit. In February, I decided I had no choice due to Keene Housing Authority becoming no smoking in buildings. Down to approximately 3 or 4 cigarettes a day with the patch. Hey, I'm kicking it. March 3rd, I went for a mammogram. A large lump was spotted, then for a CAT scan, then the results. Large tumor in center of chest, pushed through my breast and working toward underarm. The best prediction, I can't live 6 months. Worst prediction, 6 to 8 weeks. My family cries, I keep saying I'm sorry, so here I sit. In 1 month, I am on hospice, use a wheelchair, and lost most independence. My legs too weak to walk. I want to tell my story. It may help even one person to quit smoking. She said the cancer is called small cell. Unfortunately, small cell almost always comes to anyone who smokes. It moves fast. My world crashed just 31 days ago. I pray that anyone still smoking will be bothered by this letter. I pray that when you light up your next smoke, I will be able to come to mind and you put that cigarette out. Her name was Patricia Burns. She lived at Central Square Terrace. She asked me to share this letter with her. She actually died in May of 2010. So just a couple months later, she was gone. And she attributes that to her smoking. So policies are great if we get them implemented in time. We can prevent young children from being exposed to the secondhand smoke and from seeing their role models smoking. That may be another preventive course that these policies may contribute to. So this was very compelling for me, and since she asked me to read the letter, I try to share it in as many opportunities as I possibly can. So that's one reason that we're doing the work that we do.
It's amazing that she really was able to put that together and share her story, and condolences even now, I'm sure, to her family, because this has to have been devastating for them. But it really does point to that policy as a really proactive measure. It becomes so critical. When I think of secondhand smoke in particular, you mentioned the role modeling piece. That's one aspect of it. But I think research also shows that people that are exposed to secondhand smoke oftentimes become smokers just because the nicotine and everything else has been absorbed at some level in their bodies. So they're more likely to use, and it's not just the role modeling piece.
Right.
And
well, it's addictive. Even the residue can be addictive. Yeah. We may not realize it. I remember going to a doctor when I was a young person, an adolescent, and they said, you were probably addicted, because my parents smoked. Both of them smoked in the car, windows rolled up, driving around the country. I was probably addicted at a very young age and didn't know it. And so I had a little cough. As a 12-year-old, I had a cough that sounded like a truck driver cough. And, it can be very addictive for people. And I know I did talk to a restaurateur. I don't know if you remember the restaurant 176 Main. And they said that after the smoking policy changed in restaurants, one of the restaurateurs actually felt like she was going through detox, because there was so much smoking in the restaurant for so long that when people stopped smoking, she, a non-smoker, felt a little like there was a withdrawal symptom happening for her. And I don't discount that. I think that's entirely possible that people may experience that themselves, even as non-smokers, because it is so thick in the air. We may not see it, but it does exist, and it falls on everything. There are particulates. A substance called third-hand smoke is like when the particulates drop to the floor or to fibers in your home, then it kind of creates a little stew. It's a little toxic stew that people are exposed to. So there's even third-hand smoke evidence that shows that third-hand smoke may be an issue for some families and for some children.
So go ahead,
I was going to
Tammy.
say, you're correct too. We are just now starting to get some studies about the policy work. Smoke-free, not just homes, but smoke-free in the workplace. Right. And some new studies that have just come out are saying that it is an evidence-based practice that will prevent youth from smoking. That by enforcing and implementing these policies, smoke-free workplace, smoke-free homes, that it is something we can do to prevent youth from ever starting to smoke. I mean, that's pretty powerful. When we have people say, well, what can we do? We want to help. This is what you can do.
Well, and I think that's an important message here is, people are wondering, what can I do? You've got the We're Tobacco Free campaign and initiative going on. It sounds like people can become part of that. Is that correct, Tammy?
Absolutely. I am working actually with the town of Winchester right now. They are, they've implemented, I'm so, amazed at what they've been able to do. I was talking to Margaret Cheshire, who is the zoning and code enforcement of the town, and the town voted in a new housing standard ordinance. I don't know if you know about it.
I'm familiar with that,
Yeah.
yes. It was
And,
exciting.
it was really incredible listening to her. I mean, so they have decided that we can protect the health of our citizens by focusing on their environment in their home. They're taking it to that step. So I'm working with volunteers in all towns in the Monadnock region, whether you're a tenant, if you're a landlord. I'm going to be reaching out to COPD folks that struggle with that. Asthma, I mean, this is particularly important for them. So yes, they can absolutely help.
So how would they reach out to you, Tammy, if they were really interested in seeing policy work happening either in the location that they may be living or they want to be involved in it as an advocate?
Absolutely. It's an easy one. It's email smokefreehousing@cheshire-med.com.
Okay.
So that's our email.
Great. I'm going to ask you for that again
Absolutely.
at the end. So, Kate, you mentioned the electronic cigarette piece as well. Does the policy work include the electronic cigarette piece?
Well, by definition, the electronic cigarette is a tobacco product, and that's by the state law. So that is included in the definition of tobacco. And I think that the jury is still out on all the potential harms or benefits of the electronic cigarette. And so there's a lot of research that needs to be done, but policy-wise, we do include that in the definition of tobacco. So I would assume that because there have been some products that were not necessarily safe, and they are not regulated. And so there isn't any uniformity as far as batteries are concerned or the contents of the cartridges that are in the electronic cigarettes. So I think that there's a lot that needs to really be done as far as making them safe and healthy for folks if they're going to go that route. So as far as policies, like the school policy, for instance, the substance abuse policy, tobacco policy in the schools does include the electronic cigarette in those categories. So they are prohibited. They're also prohibited by law, according to our state law, from being used by or sold to minors, anyone under 18.
A lot of states now have changed the age you can purchase tobacco products, some by town, some by state. Some have changed their policies related to secondhand smoke. Can you share at all maybe some of the policy change where that's occurred and what the impact has been in those locations?
Yeah, Kate, you might be able to, just because of your time here, might be able to speak a little bit more on that.
Well, in Keene, we have the restaurant ordinance went into effect in 2002, and that was just after the hospital actually became a tobacco-free campus in 2000, which, believe it or not, was very contentious. There's great concern, and understandably so, that we want to make sure that we're not treating smokers like outcasts or second-class citizens. It's not about choice so much as it is about addiction. So we really need to be cautious about that. And there was grave concern at the hospital in the administration that having a tobacco-free policy might alienate folks, and maybe we would lose staff and patients won't come to our campus anymore. Well, none of that proved true. Actually, people are much happier, and staff are much happier, and our patients are much happier. No policy is without some flaw or some pushback, but we were able to kind of pave the way and walk the walk and setting that policy for ourselves in 2000. Soon after, the city of Keene passed an ordinance in 2002 led by the great late Mayor Mike Blastos, who was a restaurateur. He owned the pub restaurant, and he was the first one to start that initiative by making his own restaurant smoke-free. There was a lot of fear then that people were going to lose business, and that also proved to be false as more and more restaurants became happy that they passed the ordinance, and so happy, in fact, that when the state of New Hampshire's preemption came into play, and the state of New Hampshire said you can't have a law in your city that's stricter than our law at the state level, the restaurants in Keene stayed voluntarily smoke-free. So there was so much success greater turnover in tables, so people were coming and going. They weren't just sitting in the restaurant, say, all day, drinking their coffee and smoking cigarettes. And so restaurateurs were really happy, and it helped to improve their maintenance costs and that kind of thing. And also, the main reason for having those worksite policies, like the bars and restaurants, is to protect the workers who are there all day long and exposed to that. So, you know, we're seeing that even casinos across the country are examining their tobacco policies, and you'll find some more smoke-free casinos, and we have smoke-free airplanes now. So more and more work sites are adopting policies to protect their workers. It's not about pushing people out or trying to point fingers at folks. We really just want to protect people that don't use tobacco from experiencing some health effects from the exposure to that secondhand smoke.
And it sounds like the work even over with the housing, whether it's the housing, Keene Housing or Cheshire Housing Trust, SES's programs. It sounds like that's also to protect those perhaps that are not using tobacco products.
Oh, that's it.
Absolutely, and that's
Yeah.
it. Like one of the things I think I used to say to Kate, I wish secondhand smoke was blue. You know, I wish people could see how it can go through everywhere. You know, this is not trying to tell people that they have to quit smoking. It's not what the policy is about. The American Society on, I got to get it right, Heating, Refrigeration, and Air Conditioning Engineers, which are the standard-setting body on air quality. They produced a report in 2010 that said there is absolutely no way with air filtration to eliminate the health risks of secondhand smoke.
Wow.
No way. You can have the most sophisticated air filtration system, and it will not eliminate the health risk. So I would love if people could see how I'm a smoker and I'm in my unit, and so next door, they could see the smoke go through. So, you know, it's not about not wanting to let you smoke. It's trying to protect those other people.
It is, and it's really interesting because I can remember one of my work environments here. They changed the smoking policy that people could no longer smoke in certain areas around the building. Well, then cold weather hit, and they decided they were going to go into one of the garages. Well, the garage was attached to the building.
Yeah.
And, you know, suddenly I realized, wow, you know, I can smell tobacco like all the time. And I have asthma, so I'm very conscious of it. And so I actually went to the employer and I said, you know, it's coming right underneath. I'm sure, I wish I could see it in blue.
Exactly.
But I was quite sure it was coming through the baseboards of the building. And so they actually implemented a policy that you had to be a certain number of feet away from the building, and they set up smoking areas away from the buildings. And it made a huge difference.
Yes, absolutely.
But you can absolutely smell it.
Well, you know,
Absolutely.
Kelly, many people feel that, you know, non-smokers are just being picky. And it's really not about being picky. There are some people that do not smoke that may have asthma or COPD are really physically impacted. In fact, they did some studies in Montana when they implemented the smoke-free restaurant law there many years ago, and they examined the number of ER visits by cardiac patients, and found that as soon as that policy went into place, those cardiology visits, you know, because of cardiac events, were reduced dramatically over time. So we know that there are we're really making a health impact when we're reducing the amount of exposure to secondhand smoke. If anybody has a question about exposure in their own units or their own apartment building or something or environment, we have an air quality monitor that we can take in, and Tammy has the air quality monitor that we help folks with, and have actually been able to monitor like common spaces. And so maybe you think, you know, I'm just smoking in my apartment, it's not going to affect anybody in the hallway. And what we found is that we find dramatic levels of carbon monoxide exposure in hallways. And carbon monoxide is really a lethal gas. It's poisonous, it's invisible, you can't smell it, right? And that's one of the dangers, is that exposure to the carbon monoxide. So we can test the air for that.
Right. And I did, actually. Cheshire Housing, before they went smoke-free, they actually wanted a baseline. They wanted to see what the readings were like. And so I took the air quality machine, we went to all of their buildings, and clearly you could tell folks who were smoking in their unit, but non-smoking units next to those, the readings were off the charts. So, you know, it's real.
There's no way to effectively segregate that tobacco smoke. And that's really why when they designed the clean air law in the state of New Hampshire, there was some concern, and it does say in the law that if you have effective segregation, you can allow smoking in your business. But they also proved through the company the organization that Tammy mentioned, that there is no effective segregation. So it's a moot point.
Wow. You know, a little bit overwhelming sometimes when you think about it, and it's great work that's going on. But we have people that may be in immediate need, who really are either trying to quit because maybe they've, much like the story here, they've facing some kind of a health impact in their lives. Or maybe they're just, wanting to be really proactive in terms of parenting and how they work with their children around this issue. How do they reach out to the two of you to really receive assistance?
They can call my number, 354-6513. It's my direct line. They can contact Tammy at the hospital if they're interested in finding out more about smoke-free housing. It's smokefreehousing at cheshire-med.com. We're happy to respond if we possibly can. And, I'd say one thing that parents can do is to just, really pay attention to what your children are doing and who they're doing it with. And also to continue to support policies, like support efforts to fund programs like the Quit Line. The Quit Line at the state of New Hampshire is another opportunity for folks that maybe they can't access local resources or get out to a support group meeting that we have monthly at the hospital, or maybe they can't come to an appointment, but they can pick up the phone and they can call the toll-free number, which is 1-800-QUIT-NOW. But we need to continue to fund those kinds of programs. And the state of New Hampshire did receive $125,000 to fund the Quit Line. And I think that's really the only money that's being spent toward prevention and treatment in the state right now. So really want to support policies that help the Department of Health and Human Services continue these prevention and treatment programs.
So people can be good advocates.
Yeah, absolutely.
People can be an advocate within their own environment and reach out to you, Tammy, and really say, hey, we need to change things here where we live. And it's not about punishment.
No.
It's really about the health and the well-being of all of our citizens and how we take care of each other.
Absolutely.
So we may choose to smoke, but how we take care of our neighbor becomes very, very important. And recognizing that they may have health issues that you're not even aware of, and that your behavior has impact on their well-being. And I think sometimes we forget that neighbor to neighbor or family member to family member, what we do and what we choose to do can have impact on someone else. And it may not be negative for us, but it could be incredibly negative for them. So I think, the other thing I want to point out is we got to see the WTF, the We're Tobacco Free, that stands for.
Yes.
But you also have Jeff on here.
Yes.
So tell us about #JeffWeCan.
Yes. Do you want to?
Jeff, we can. Well,
this is
I love this message. It seems to be a little bit more child-friendly. This is a diseased lung. It's a pink diseased lung. My husband thought it was a potato, but it's not. It's a lung. And this was actually a design by John Oliver, who's a late-night television host, who really put the spotlight on the tobacco issue and tobacco control problems around the globe. And he offered this up as a counter symbol for that other icon that you may be familiar with that has cowboy boots and a cowboy hat. And so really wanting to get us to pay attention and just get back on it and be positive. Jeff, we can do this work. And so we want to put a positive spin on it and just show kind of how silly it really is to actually start. But I love that it got attention on late night TV, and we have adopted the symbol. He gave the tobacco control community permission to take on Jeff, and so we're promoting Jeff whenever we possibly can. So
Yes,
hashtag
yes,
Jeff We Can. You can visit Google hashtag Jeff We Can, and you probably will get a link to John Oliver's segment that he did, which also brings to light a lot of things that you may not realize about what's going on with tobacco in the world.
And I think that's important as well, and I would hope people do take a look at that message, because I think you mentioned early on that we've sort of feel like it's taken care of. And I think, as policies changed in restaurants, as policies changed in the workplace, people thought, oh, we're solving the problem.
Right.
We haven't solved the problem, and that's an important message to get out there, that it continues to be ongoing work. We have a new generation of young people coming along. We want them to be as healthy as possible, and hopefully in the future, we have a future generation that is role modeling very, very differently.
Exactly.
So if somebody wants smoking cessation, I believe you also have free patches available.
The
Is that
state of
true?
New Hampshire has free patches.
Okay. So there's patches available for people who want to stop smoking. There's support groups available through the hospital here. And is that true also on the other side of the mountain?
I'm afraid that there aren't a lot of programs out there right now, but I do
Okay.
know, I think Monadnock Community Hospital has started something. I'm not sure to what degree that they have taken that on, but I think it's starting to get some kind of energy around. Unfortunately, with the funding change, there aren't a lot of people able to provide this service across the state. So, the best bet if you don't live in this area is to use the Quit line, and it's at 1-800-QUIT-NOW, and they are giving out free patches while supplies last. And if you call me, then you can do a one-on-one consultation. We also have the free support group once a month, which is called Tobacco Free or Trying to Be. Anyone is welcome, whether they've quit or not. And then also just, if you want to talk on the phone or email, then we have that as an option as well. So we really try to offer as much as we can to folks, so that, because we need to break down the barriers that prevent people from getting the help that they need. Again, this is not about punishment. It's not about, pointing fingers or telling people what to do. We're just trying to give people support so they can find their path and making it work for them.
So we have that piece in there. We have the policy work going on, the great policy work. The schools have been doing a lot of work trying to do prevention education, trying to also make sure policies are in place within the school environment. So all this great effort, and people can support it. People can become advocates. They can become volunteers, I would guess.
Absolutely.
I'm sure you need volunteers.
Absolutely.
And do you have any upcoming events that people should be aware of?
Well, the Great American Smokeout is a great event that people can just support that, and by just helping someone to become tobacco free for the day. It's an effort, just to, it's a national initiative to encourage people just to try it out for a day, because really one of the things that get in the way of people quitting is their fear of quitting. So if you just try it out for the day, then you'll find it's doable. So that's the only other event that we've got going on right now.
Well, and can I add just a
please,
quick, what I was thinking about when you were talking about advocating, one of the things that I've learned just from listening to Kate, I mean, she's really amazing working with people trying to quit smoking, is to be understanding. If you have somebody that smokes, it is an addiction. And people, one of the biggest obstacles that I've seen is people think that they should just quit cold turkey. And they should be able to do that. And most people can't, so really being understanding if you love someone who smokes,
So that's an important message in there, and I think we all have to remember that. What's the date on the Great American Smokeout, Kate?
It's always the third Thursday of November.
So that'll be coming up fast. You'll be looking for volunteers, I know,
Absolutely,
for that, to be understanding and to help people for the day be able to quit. And I know you have little care packages
do.
and
We have
people that talk with them and are on hand. And again, an opportunity for the day to try it out and see where you want to go from there. Tammy, it's exceptional work that you're doing right now. I mean, I am so excited to hear about this. I'm hoping that we see it grow into an initiative, perhaps like what England has done with secondhand smoke in the cars, and that people in child restraints, you cannot be smoking in the vehicle. That would be incredibly exciting
Fantastic.
to see here.
Yes.
And I understand from before the show started that Maine has actually implemented that policy. I'll be interested in having you come back on the show at some point and share with us what is some of the impact of these types of policies. How is it changing people's lives out there? Perhaps we can even get somebody on the show where their life has been really changed.
Yeah.
I don't want to leave today without really highlighting that this becomes part of the whole health of and well-being of the community. When we think about it being really a healthy initiative going on here in the Monadnock region, this becomes a critical piece of that, and it's one element of it. I know it's part of the future community health plans that are being proposed at the state level, and that it'll be a priority for the Monadnock region. For all the reasons you mentioned, Kate, we have young people still at high risk for this, and we have adults in need of intervention and treatment services. So any final thoughts that the two of you have, or things you want to share with the public?
You know, we have an opportunity to finish it. You know, we can do this. It is very doable. But we have to have the right combination of things, a comprehensive approach. We have to make sure that children aren't able to buy tobacco. We had 3 stores in Keene that sold tobacco out of 18 recently to underage buyers. We need to stop that, and we need to help people quit, and do look at the overall picture. The 3 top things that we can do to improve the health of our community is to eliminate tobacco use, to help people eat right, and get more exercise. So it's definitely doable, and it's going to take all of us working together to get it done.
What a super message.
Yeah, I think often there's so much going on in the world that we want to make better, that at times that we can feel powerless, and this is something that you can do. You know, contacting us and helping us with this initiative, we will find action strategies that you will feel powerful, that will make a difference.
Super way to end the show. I want to thank both of you for joining us, and I want to remind you, audience, you just heard it from Tammy and Kate here, that you have an opportunity to give, to volunteer, to advocate, to live united. Thanks for joining us.